we are here to talk about heart disease and keeping our heart health in check or staying healthy from a cardiovascular standpoint. Some common risk factors that we ask for and we look for are, for example, smoking. Smoking is something, it's the greatest contributor to heart disease. We look at a patient's, weight. We look at a patient's blood pressure. Dr. Asmar will talk to you about the importance of blood pressure control. We actually always check a patient's cholesterol level because cholesterol is something that will have a big impact on somebody's risk of developing cardiovascular and heart disease. The patient is either at risk or pre-diabetic or diabetic, that imposes a greater risk of heart disease. So those are, some of the risk factors that we always check for, and that allows us to put our patients into different risk categories. So if you're somebody who does not move almost at all, starting a little bit of exercise, walking at your own pace, 5 minutes, 10 minutes, 15 minutes, increasing very small amounts over time, reaching baby steps, I call them. Studies have shown that mortality overall does decrease if we become more active. We call them going from the couch potato to just walking.
I want to actually start by congratulating all of you for coming here. I think if you come here, it means to me you are invested in your own health care. You're taking the time out of your busy schedule and you want to be here so that you can learn something. So I think I want to start by congratulating you for doing that. I think that's a very good first step. So hypertension really affects about 70 million. So 30% of the adult population have high blood pressure. The way I look at it is, if you have a door and you're trying to open the door and there's a giant standing behind that door. So that's what blood pressure is to the heart. The heart is trying to push against this blood pressure and somebody's holding that door, right? So the heart is constantly having to work extra to open that door. So finally the heart will fade. When we talk about high blood pressure, there are 3 organs that suffer the most from the effects of long-standing high blood pressure. Can you guys tell me what are these organs? Let me start by one, the heart. The heart struggles. Kidneys, thank you very much. Doing me feel much better. Right? What else?
The brain?
Yes, heart, kidneys, and brain. It's actually damaging organs every time, every second. Is that clear? So that's why blood pressure, when they say it's asymptomatic, is a myth, because it's constantly causing damage. Now let's talk about out-of-office blood pressure. The question that I get asked most of the time is, what machine should I buy? And I tell you, really, I don't work for any company. I have no stocks in anything. But there is a website that actually is called Dabble Educational. So I ask people to do it 7 to 21 days. You record it regularly, and we average the numbers. You do not want to do it if you're very anxious and blood pressure measurement becomes your full-time job. Make it complementary so that your healthcare provider can help you manage your blood pressure.
When you find yourself in the office with the cardiologist, usually it's because either something was found wrong, abnormal, or you were identified to be at really high risk and you might need some testing. The risk is if you have a first-degree male relative having had diagnosis of heart disease before the age of 55 or female before the age of 65. So your homework assignment when you go home tonight is to figure that out and help everyone in the family know if there is a family history for premature heart disease. The known diet of aspirin is greatest in men over the age of 40. Probably could reduce the risk of heart attack and stroke by 20% if they started taking as little as a baby aspirin daily. In women, there's more debate about that. There's been mixed results about healthy women taking an aspirin a day, whether that truly will reduce their risk of heart attack and stroke. Fruits here, we have a vegetable tray. She has a little bit of cheese, which a little bit of cheese is okay. And chocolates, there's actually been several studies talking about how a piece of chocolate a day can actually be heart healthy. There was a study that came out that showed that eating at least 3 to 5 servings of blueberries and strawberries a week can reduce your risk of cardiovascular events by nearly a third.
When we have a car maintenance come out, we take our car to the dealership right away. But when we have something wrong, we wait, we sit on it. We're just a human being tendency, and we need to be opposite. You know when it's something is not right. And the symptom varies, like Dr. Castiglioni said, it's different for different people. But make sure the fact that you don't have risk factor, you're not immune.